So my name is Michele Caggana, and I, along with Dr. Joanne Bedurtha, are co-project directors for NYMAC, the New York Mid-Atlantic Caribbean Regional Genetics Network. We also have our team on board today to help everyone out, and we'll talk about that in a little bit. So our region includes, for those of you that don't know, our region includes Delaware, Maryland, New Jersey, New York, Pennsylvania, Puerto Rico, Virginia, the U.S. Virgin Islands, and West Virginia. And you're going to hear a lot more about NYMAC from Alyssa Terry early in this morning. So I want to take this opportunity to welcome you to it's our second virtual NYMAC meeting. We have 392 people registered for the two-day meeting, and we're so happy that each and every one of you can join us. We're hoping that we provide you with a combination of new content to enhance your knowledge regarding genetics and telehealth services. And we also hope to present information that you could use in both your personal and professional lives regarding not only access to genetic services, but also how to engage with your provider as a team member to make the most of your genetics experience. We're going to explore ways that providers can assist in service delivery. And more importantly, we hope to learn from you, all of our stakeholders in the region. I'm sure that you can appreciate we have a full agenda, and I'll go over the format of the meeting shortly. So with that, I'm going to turn it back over to Erica, who's going to give you a primer on the platform and some tips on how to make the meeting enjoyable for you all. So again, welcome. Okay, so I hope everyone had fun in the breakout room, and welcome back for the first kickoff and intro. I wanted to start off the day with a moment of silence though. Each of us that are attending this meeting has likely been impacted by the global COVID pandemic. And as we were just saying, people are eating outside, the weather's getting warmer. So while it feels like we might be turning the corner in some places, probably people in this room, in all of these rooms, have been ill or had family or friends who became ill. And also some of us have lost close friends, family members, or acquaintances in our communities. So further, and in addition, we may have suffered our own incalculable ways. So I just wanted to take a moment to let us all reflect in silence. Okay, thank you very much. So the first thing I'd like to do today is actually introduce our team. We've heard from some of us, and we've met us in some of the breakout rooms. Our advisory committee is chaired by Andrea Durst, and our members are listed here. They're from across the region. And then our NYMAC team, which also includes Andrea as our chair of the advisory committee, is listed here. And the people that are in italics have our nice NYMAC virtual logo behind us. So just like Erica's team has her background, you can find us by our NYMAC background. And then also we'd like to thank our program officer, Soo-Yun Kim, and Megan Lyon from the National Coordinating Center, who oversees all of the regional genetics networks. So if you have questions, feel free to reach out to us in the chat, or we'll be reachable and obviously around throughout the entire meeting. Okay, so we have a couple fun activities. The first one is a poll, and we would like to have everyone figure out or determine where, or click on the bubbles here to see where you're calling in from. So just take a moment to do that, and then we'll see where everybody's from.
All right, Michele, the numbers are coming in fast. We've got almost 100 people have voted so far.
Okay.
I know you may not be able to see these results, but I'm watching them come in. So they're starting to slow down a little bit. We've got about 80% of people voting. So I'm going to show the results. I'm going to count down from 5. So get your votes in. 5, 4, 3, 2, 1. And here are the results.
All right, we have New York and New Jersey. We're combined, so we have to. We only had so many options in Zoom, so we had to combine New York and New Jersey. We're attached by numerous bridges, so then Pennsylvania, Maryland, DC, Puerto Rico, and some others. So potentially outside of our region. So it's good to, again, having this virtual meeting allows people to join from around outside of even our region. So that's great. So as you saw in the poll, we also have people who are attending from Puerto Rico, and we also have the US Virgin Islands represented. This year we welcomed Puerto Rico and the Virgin Islands to our region. Previously they were in the Southeast region. And years past, many, many years ago, there was this thing, and I know some of the people who I saw their names on the Zoom, some of those folks had remember the Council of Regional Networks, or CORN, and we belonged to this group called GENES. And at that time, Puerto Rico and the Virgin Islands were actually part of our region. So we're happy to say after a several-year hiatus, we're welcoming those two areas back to our region. And I also want to take this opportunity to welcome our families and our advocates to the meeting, because we learn a lot from you by interacting and learning things from your perspectives. And again, the virtual format allows, presumably and hopefully allows people to participate more than they would be able to get away from their family to attend a meeting in person. So thanks for joining us today. And our next poll, which I've kind of alluded to, think back and let us know how many NYMAC meetings you've actually attended. And I know that there's been quite a few who've attended many, and hopefully we have some new people as well. So go ahead and click the bubble for your attendance.
Here they're coming in. We have a sort of a forked result here coming in, but there's a strong leading answer here, Michele.
Hopefully it's the right one.
They're all the right answer. I'm just piquing your curiosity.
I know.
You want to make a prediction. This is a popular poll. We're already up to 110 people voted. People are fast in this meeting. I'm going to count down. Last chance. 5, 4, 3, 2, 1. Here you go.
Yay. That's what I hoped. So it's good to see that the majority of people are here for their very first meeting. And there's been a few kind of somewhat evenly distributed amongst the others, but we're really happy to have all the first-time people joining us. And I hope you find this useful, as we will, as our team does as well. All right, thanks for playing with us on the poll. I just wanted to mention that Erica, who you already met, and her event production team have partnered with NYMAC to produce our annual meeting this year in Zoom. The goal is to help create opportunities for people to connect and collaborate over this 2-day program. It's a long and action-packed 2-day. As you heard earlier, her group's going to be handling all the behind-the-scenes work, and hopefully everything will look seamless to you. And as she mentioned earlier, continue to pay attention in the chat as the day unfolds, because we'll be either asking questions or giving you information or helping you figure out where you need to be and where you're headed. And again, if you have any technical assistance needs, please ask in the chat, or scroll back up and get all that information that was posted earlier about where you can get assistance. And so I want to thank them, because they've been absolutely great in helping us put this together. And also last year we did this on the fly ourselves, and it was incredibly stressful, but we were able to pull it off, and it was sort of a last minute thing with the pandemic. So we had been waiting last year to figure out whether or not we were waiting to figure out the whether we'd be able to be in person or not, and we had to go virtual. So I'm going to quickly go through the agenda here. We're going to start off with 2 lectures. The first is going to describe how genetic diagnosis is made, and then we'll hear about how this information can inform tailored treatments. And then next, we're going to learn about all things NYMAC and how we're working in our region and using a team-based approach to do our work. And then remember, both days at lunch, our exhibitors will be manning their booths, so take time to visit them, and we also have a NYMAC room as well. Then after lunch, you'll learn about how organizations use different approaches for family engagement, and so that providers can better understand the needs of their families. And then we will be hosting 2 concurrent workshops, so you can pick which one you want to attend. One's beyond the diagnosis, and the other is bilingual genetics providers. The first one is going to address discuss challenges to families that they have brought to people's attention kind of after the diagnosis. So you get the diagnosis and then what? And that's what that will cover. And then the second, we'll seek to build consensus among bilingual providers and their patients, and resources and solutions to this will be shared in that breakout. After the afternoon break, we're going to have a session on cultural dexterity. And then after the meeting, we will continue the conversation in a set of breakout rooms. For day two, again, we are going to start off with 2 lectures. One will discuss the changing landscape of telehealth and give you some resources, and then discuss how telehealth can be adapted for telegenetics. And then the second talk will review primary care and geneticists, how they can interact to create successful partnerships. We're going to learn about genetic services delivery in Puerto Rico and the U.S. Virgin Islands via a panel. And then we'll have a session on barriers to care and cultural considerations when delivering genetic services. Again, our lunch booths, the exhibitors will be open. And then we're again going to have 2 concurrent workshops. One regarding patient involvement in registries and how your participation can help improve outcomes overall, and also aid laboratories in interpreting genetic results by having your information from registries available to the people who are doing the sequencing work. The second workshop will focus on tips for families to have a successful telegenetics visit. And then we will have a break on how to plan a continuous quality improvement project with Yvonne Gunther Keller, who's an expert in that. And then again, we will have conversation after. So as you heard earlier, the open sessions are going to be recorded and the breakout rooms are not being recorded. We're going to make recordings and slides, and also these slides specifically will be available to participants after the meeting. And we hope to, what we're trying to do and we hope to be able to do is allow participants who couldn't join all the sessions get their CME also by viewing the program content afterward. There are things we have to do after this meeting to make that happen, so watch for some information from us regarding that as well. This is information, and again, these slides will be available to you, so you don't have to really scribble them down. But the National Society of Genetic Counselors has authorized us to offer CEUs or Category 1 contact hours. This is good for genetic counseling certification and recertification. The important thing is that you have to log in live to the webinar. You can't just call into it. We have to have proof. We have to give proof to the NSGC that you actually did participate and attended the meeting kind of while it was going on. You're going to have to go to the website and enter your user ID and complete a form after the meeting. And if you have questions, you can contact Alyssa at the Gmail that's shown here. And again, this information will be made available to you as well. So these are in order to get the ACMG CME, continuing medical education credit. There's a set of slides again that you will be able to review. One of them here is a disclaimer that just says, you know, what you and what this meeting is in regard to. So you can just take a look at that quickly. The next 4 slides have a list of our presenters, and I'm not going to read every presenter. They're in the agenda, and as the meeting goes on, we will be able to have their bios pasted into the chat, so you'll be able to read about their backgrounds as they come up for their presentations. So we have quite a series of presenters. These include our team members, our NYMAC team, and a lot of our colleagues within the teams and within NYMAC, and including the Puerto Rico and the Virgin Islands as well. The financial disclosures, and so these are the disclosures for our presenters. Only Dr. Chung and Randy Zinberg had disclosures. Everyone else had nothing to disclose. And the same for the planning committee. So the educational credits are given here. If you participate in the entire meeting, you get 14 Category 1 credits for continuing medical education, and that's through the ACCME. So people that do this routinely are familiar with ACCME. And in order to get credit, the most important part after you attend the meeting is that you have to complete an evaluation. We'll be distributing that to you via email, and you have to complete the evaluation, and then you'll be able to print a certificate and get your credit recorded. And the learning objectives for this session, in order to get your CME, the goal is to summarize several well-curated resources on genetic topics and conditions that are available to primary care providers that can be used throughout the referral process in managing patients with genetic conditions. Also, to list opportunities for broader engagement of providers, families, public health entities with family organizations. And then lastly, to identify opportunities for new collaborations between NYMAC and your organization. And we hope this meeting really helps with those objectives for everyone. So a few quick thoughts. As I alluded to, this meeting took a virtual village to plan. So we're excited to have you all here. And I want to thank our planners who were on that slide, as well as Pat Bish and Alyssa Terry, who took on a bulk of the planning and kept us all organized. Thanks to Erica Marks, Fred Brown, and their team who are on board for technical assistance. Don't forget to visit our exhibitor booths at lunch and during breaks each day, the lunch break each day, and also have fun in the polls and the interactive content. We're going to actually give you an opportunity to complete a brief evaluation that's separate from the CME, and that will give us feedback to make our program and our meetings even better in the future. And so you'll be given an opportunity to do that, and we would really appreciate if you could complete that quick evaluation. And we did our best to keep it very short. Also, please check out our newly furbished and ever-evolving website, and come back often, because we're going to be adding more and more content to it, and hopefully materials that are more and more useful for the community. And also check us out on Facebook. It's NYMAC-New York Mid-Atlantic Caribbean Regional Genetics Network. You could just search and find us, and we'd really appreciate if you could join our social media network, and you'll have an opportunity to do that later in the day as well. And again, thanks so much for joining us, and I'm happy to turn it over to my colleague, Dr. Joanne Bedurtha, to kick off our first educational session.